Welcome to my channel Farm Easy, where you will learn clinical pharmacy and therapeutics incredibly easy. Many a times during case presentation, students go wrong while explaining the elevated WBC count, which is also called as leukocytosis. Now, why they go wrong? Let's learn. WBCs are elevated in bacterial, viral, or parasitic infections. WBCs are also elevated in any inflammatory conditions such as rheumatoid arthritis or even in autoimmune disorders. WBCs are also elevated in asthma, COPD, or any other allergic conditions. Even WBCs are elevated in certain bone marrow disorders or in cancers such as blood cancer. So when a patient presents with elevated WBCs, students tend to justify that there may be a presence of inflammation or infection or presence of fever. But throughout the case, we don't find any evidence of infection, inflammation, fever, including elevated CRP or ESR. So from now onwards, students must understand that even in the absence of infection, inflammation, autoimmune disorders or asthma or any other cancers, still WBC can increase. And what are the risk factors? Many individuals suffer from work-related psychological or physical stress such as fatigue, anger, anxiety, tension, depression. In these cases, WBC will be elevated. In these stress situations, there will be a high production of adrenaline and cortisol that leads to elevation in WBC. That means when you externally administer certain medications such as adrenaline or corticosteroids, which increase the cortisol level in the body, leads to increase in WBC level. Even individuals with poor sleep, unhealthy diet, obesity, smokers are also shown to have high WBC count in their blood. So this elevation of WBC in the absence of infection, inflammation or elevation of CRP and ESR is called as reactive leukocytosis. But this elevation of WBC is temporary, and once the risk factors are removed, the WBC normalizes. Otherwise, persistent elevation of WBC due to these risk factors can lead to cardiovascular complications such as heart attack and stroke. So next time, the students should be very careful while interpreting the elevated WBCs in the absence of infection, inflammation, or any other autoimmune related diseases. Rather, they should properly take the history of the patient to identify the presence of those risk factors. Thank you for watching my videos. If you want more informative videos like this, don't forget to like, share, and subscribe.